Okay, so hello everyone and welcome to our session for today. Today our session is about mastering skills. It's a session for skill mastering. Our skill to master today is how to start your station perfectly, how to nail the first 10 seconds of each single case. All right? We are going to have some practicing on how to start the station in different situations. All right. It's extremely important to know how to start your station confidently with the patient. This will give you a confidence in yourself to go through the case smoothly without any struggles. Today we are going to learn how to make a good first impression. The first impression is the last impression. So it's very important to give a very nice, good, confident impression to your simulator and to your examiner. Okay? So what's our aim for today in this session? At the end of this session, you will find that you have a very, very good insight, huge insight about how to start your station confidently in each single scenario. Okay? So the aim is to equip you with the communication, nonverbal, and interpersonal skills needed to create a strong, confident, first impression in the first 10 seconds. Okay? What are our objectives to reach this aim? Understanding the importance of the first 10 seconds. The second objective is demonstrating appropriate non-verbal communication technique. The third one is identifying and avoiding common mistakes that lead to poor first impressions. And lastly, initiating the station with a structured and effective opening tailored to different situations. Okay? So let's take one by one of the objectives by one to reach our aim. All right? The first one is understanding the importance of the first 10 seconds. Why the first 10 seconds are important? As I mentioned before, the first impression is the last impression. First impressions are lasting. If you give a very good, confident impression from the start, believe me, throughout the case, you will find the simulator is helping you, you will find the simulator is happy, and then you move on to the next session smoothly. All right? This impression can color how the rest of your performance is perceived. You are coloring the rest of the station. Okay? So once you enter the cubicle and you start your station confidently, the examiner and the simulator will be happy. They will help you throughout the case. Okay? You will go very, very smoothly. If you start with a very nice, good rapport, this will boost your own confidence. So if you start with nervousness, with mask face, without any friendly way, you find yourself you're nervous. You barely can say the words. Okay? But if you start with all of the confidence that you have, with a very nice smile, with a friendly way, you will find yourself, I'm confident. I can do it. All right? So it boosts your confidence throughout the case and in the next cases. All right? This first 10 seconds will differentiate you from the other candidates. Most of the doctors in the exam will be very nervous, very anxious. They can barely say words, all right? If you start confidently, you'll find yourself, yes, I'm unique. Okay? So this is the importance of the first 10 seconds. Okay? They are extremely important. That's why we are focusing on them today. All right? Okay, this is the first thing that we wanted to discuss today. Secondly, the second objective is demonstrating appropriate non-verbal communication technique. In this case, in this exam, there are verbal and non-verbal clues. Okay? The simulator will show some verbal and non-verbal clues for you to pick them up. And you as well, as a doctor, you can show some non-verbal clues to the simulator. If your non-verbal clues and verbal clues are proper to the situation, then the simulator will be very comfortable with you. All right? The verbal clues, everything the person says. Okay? The non-verbal clues, everything the person does. Okay? So as the patient or the simulator has verbal and non-verbal clues, you as well, you have to show some verbal and non-verbal clues. What are the non-verbal clues that you can show to the simulator so they can feel like, okay, I'm comfortable with this doctor. I'm going to help him. Okay, what are they? The first one is the facial expression, in addition to the posture and body language. Your facial expression should be appropriate to the situation. If you are starting a station which is normal consultation in the normal day, the patient is stable, the patient is okay, happy, so then you can start your station with a very nice smile and friendly way. Okay? Your face should show that I'm comfortable. Hello, how are you? Are you Mr. Blah, blah, blah, blah? How is everything today? With a very nice smile, friendly smile, okay? Your body posture as well. Once you enter the cubicle, you have, can you see this doctor? He's entering with straight posture, his hands in front of of him, and he's smiling. Can you see the confidence in his posture? Okay. Once you enter the cubicle, you have to have this posture with this facial expression. Okay. Once you sit down confidently. You are a doctor. Okay. Sitting upright, your back is upright, and you're just leaning forward a little bit. Okay. And your hands should be on your laps. Okay. With all of the confidence that you have. All right? Avoid the closed posture, like crossing your legs or crossing your arms. Avoid this posture, please. Okay? Use the open posture. Okay? Talking with your hands. Okay? With all confidence. Yeah. So this is in terms of the facial expression and posture and body language. The second non-verbal clue that you can show to the simulator, your eye contact. You should be able to show the simulator that, yes, I have an eye contact with you. Okay? Look in the patient's eye. If you want to think in his eye, think in his face. Don't look here and there. Okay? And this comes with practice. Most of the doctors, when they practice, they just practice behind the camera. They don't switch their cameras on when they are practicing. They just practice like it's a phone consultation. They are practicing always thinking and looking here and there, searching for the words to come in their mind. Okay? Once they go to the exam without having this experience of eye contact, they find the struggles. They can't talk to the patient's eye. They struggle in that. Okay? So it's extremely important while you are practicing, please switch your camera on. And that's why in our mentor shield practice, all of the mentors are switching their cameras on. And we encourage people to open their cameras. Why? Eye contact is very important. In UK here, they like people who are having eye contact. They like people talking, looking at them. Okay? If you don't look at the patient or you don't look at the person that you're talking, they feel uncomfortable. Okay? So eye contact is extremely important. All right? Lastly, active listening signals. You show the examiner or the simulator, I'm all ears. Okay? I'm listening actively and showing these signals. While the patient is talking, you can nod your head. Yeah, I see. All right. Okay. Active listening signals. Okay. And when you show these, you are listening. You actually listening to what the patient wants to convey, not you want to hear what the patient wants to convey to you. You listen not to answer. No, you listen to understand. Then you answer. Okay? The patient says, like, well, it's difficult for me, doctor. So you say, okay, I can see that it's difficult for you. Can you tell me more about that, please? Okay, so you show that I'm picking them up. Doctor, it's affecting my work. Oh, well, okay. I'm really sorry to hear that. So can you tell me more about your work? Or can you tell me what's your work, please? Okay, so you're nodding your head. You say, okay, I see. And then you listen and understand, and then you communicate with the patient. All right? All of these are non-verbal communication with the patient, and they are extremely important in your communication with the patients. Okay? So facial expression, body posture, eye contact, and active listening signals. Okay? This is in terms of understanding or demonstrating the appropriate non-verbal communication, which is the second objective in our session today. All right? Until now, is everything all right? Is everything clear? Yes or no? Any
Yes,
question?
yes.
Yes. Okay, good. Any question until now?
No, everything is clear.
Okay. Dr. Omar, sorry to interrupt, but I wanted to ask, will the session be recorded? The session is recorded, but when I'm going to share them, this is the thing, okay? If you want to leave, you have any important matter, it's okay. But I highly advise, if your exam is near, or if you want the session very urgently, you know, keep with us. Yeah. All right. So this is in terms of the second objective. The third objective, which is identifying and avoiding common mistakes that lead to poor first impressions. What are these mistakes? They are in front of you. The first one, no or weak introduction. This happens because of the anxiety. Or the start of the station is not normal as each station's start. What does that mean? Like in some cases, you find that the patient is extremely angry, or looking down, doesn't look at you, or the patient's jumping on you, telling you, doctor, is everything all right with my son? Is everything all right with my wife? Okay, so this is it's unusual start. Okay, and when you face this, you find yourself, oh, and then you feel like everything is gone from your mind. You have to have this structured introduction to yourself and to each single situation to be able to be confident in each single scenario. Okay? So usually you have to put in your mind this structure in terms of introduction, in terms of starting the station. You have to introduce yourself. Okay? You have to confirm the patient identity and age. Okay? You have to acknowledge the verbal or the non-verbal clue that the patient does. You have to say the purpose of this station or this consultation. 4 main points. Introduce yourself, confirm, and acknowledge, and then talk about the purpose. This is the structure that you have to bear in mind in each single station. Whatever the start is, whatever the patient does in front of you, you have to have this structure, and I'm going to say it. And when I say it, I will say it proper to this situation, okay? And we are going to talk about that. We are going to practice together on different situations, okay? In some cases, the doctor who is not prepared for that, once he starts the station and the simulator is starting with unusual reaction or unusual verbal and non-verbal clues, he finds himself stuck. He doesn't know what to say. Maybe he forgets the introducing himself. He forgets confirming the patient identity. He forgets acknowledging everything. Okay? So it's very important to be able to do this in each single station. Okay? So this is in terms of no or weak introduction. Yeah, this is a common mistake. Common mistake. Yeah, we have to avoid it. Yeah, and we are going to talk about how to avoid it. The second mistake is lack of eye contact. I've talked about this before. I'm not going to dwell on it. Lack of eye contact. It's one of the main common mistakes in the exam. Lack of eye contact. Please have an eye contact with the patient, with the simulator, please. Okay? The third mistake is rushed or muffled speech. From the anxiety and the nervous of the exam, when the doctor starts to talk, he can barely talk. His speech is muffled. He can't talk. Why? He's just listening to his heartbeats. His heartbeat is in the sky, okay? And he just doesn't know. Everything in his mind is gone, all right? Why? Because of the anxiety. How to mask this anxiety? By starting the station confidently. How to start the station confidently? Please be friendly, smile. Smile with all of the confidence in yourself, okay? If you don't smile, this is a mistake, okay? If no smiling, no warmth in your introduction, this is a mistake, and this is a common mistake because of the anxiety. Let's, do an example or take an example. The first one, a doctor who is just anxious, masked face, starting without any feeling because of the anxiety, okay? So he starts like, hello, hi, how are you? I'm Dr. blah, blah, blah, from the hospital. Can I confirm your age, please? Can I confirm your name? Thank you. So how can I help you? Okay, this is the first one. Yeah. The second one, a doctor who is confident in himself, he's friendly, he has a very nice smile, starting the station with all confidence. Hello, how are you? I'm one of the doctors here. My name is Sahar Ali. You must be Mr. Blah, blah, blah. Yes. Oh, nice to meet you. How are you doing today? Is everything all right? Can I confirm your age, please, if you don't mind? Thank you for coming today. All right. I think that the weather is good today, isn't it? Okay. So can you see the difference? Can you see the difference? The confidence? If you do this, you will find yourself, okay, I'm okay. I can do it. Okay. So this is in terms of no smiling, or the fourth mistake. The last mistake, misreading the scenario tone. Well, we are talking about we have to smile and be friendly in most of the cases. Okay? However, there are some cases that smiling is inappropriate. You have to read your scenario carefully to find the tone of the scenario. Is it breaking bad news? Is it a psychiatry patient? Is it talking with an angry patient? Is it dealing with a medical error? All right? In all of these cases, smiling and being friendly from the start, this tone is inappropriate to the case. All right? So we have to have this balance between being smiley and friendly, okay, and dealing with being firm and confident. Okay? In breaking bad news, you should be able to have low tone of voice, talking slowly, showing all the sympathy in your face, your facial expression, show the sympathy, okay? In explaining a medical error, you have to show, you have to be confident and firm in yourself, calm and relaxed, okay? So you have to have this ability or flexible mind to change your tone and your facial expression based on the case. All right? These are the common mistakes. Please don't fall in them. Okay? And we are going to practice now, which is the last objective in our session today, initiating the station with structured and effective opening. Okay? How we are going to reach this objective or fulfill this objective by practicing. All right? Okay, so 4 objectives: understanding the importance of the 10 seconds or the start of the station, the identifying which is the best start, or knowing what are the common mistakes in starting the station, and showing the appropriate non-verbal clues. Okay, and lastly, the practice on different situations. All right, let's take examples on some questions in different situations and how we start the station in different cases. I've prepared 12 cases, 12 different questions, okay, in different situations. We are going to practice with 12 different doctors. On the start, we are focusing on the introduction of the case, how to introduce, to confirm, to acknowledge, and to say the purpose of the case. All right, let's get started. Who wants to start, doctors? Anyone? Just 1 minute. We are not going to...
I can go first.
Who is?
Dr. Sarah.
Okay, no worries. Okay, let me share the question. Just, yeah, it's here. So, read your question. Whenever
Okay.
you ready, tell me and we are going to start.
Okay. Okay, I'm ready.
Ready?
Mm-hmm.
All right. Yeah. Start.
Hello. My name is Sarah, one of the junior doctors working in this GP surgery. How are you? How do I call you?
Well, doctor, I'm Paul Bernard.
Mm-hmm. Nice to meet you, Paul.
Thank
And
you.
can I call you Paul?
Okay, Paul is fine.
Okay, Paul. Nice to meet you today. How are you?
I'm fine, thank you.
That's good. So how can I help you today?
Well, doctor, I'm having an eye problem, doctor. We have a problem in my eye.
Oh, I'm so sorry for you to experience that. That must be so stressful. Can you please tell me more about it?
Well, I have pain in my eye, doctor.
Mm-hmm. Is it in both eyes or a specific one?
No, in both eyes.
In both eyes. All right. So Paul, can you tell me more about this pain?
Well, it started 3 days ago, and
Mm-hmm.
it's getting worse.
Oh, that must be so stressful. And um, with this pain,
All right.
oh, all
This is
right. Okay.
okay. All right.
Okay.
Thank you, Dr. Sarah. Thank you so
Thank
much
you.
for your participation.
Thank
Okay, how do you feel?
Yeah, I was a little bit uh, yeah, I wasn't ready. I think this is my second time
Mm-hmm.
introducing myself
Yeah.
since I started preparing for PLAB 2.
Mm-hmm.
But yeah.
It's fair. It's fair enough. And yeah, I do agree with you. You were just, a little bit nervous or hesitant in
Yeah,
starting the
exactly.
station. Yeah. Okay. So
Yeah.
always make a structure for yourself. Okay.
Mm-hmm.
This is one of the aims in your practice. Okay. When
I see.
whatever the case is, what I'm going to say in my start. Okay.
Mm-hmm.
Put a structure in for yourself to start the station with. Okay. So
Okay.
you started by telling, hello, how are you? Can I confirm your age? Can I confirm your name? Paul
I didn't
Bernard.
confirm the age, yeah.
And then you told me, can I call you Paul? Right?
Mm. Yes.
Okay. Then you told me, how can I help you?
Mm-hmm.
Right?
Yes.
Okay. So this is one of the ways. I'm going to
Mm-hmm.
tell you my point of view or an
Mm-hmm.
idea on how to start this station perfectly, and you tell me which is better.
Okay, please do.
All right? Okay.
Mm-hmm.
Hello, how are you? I'm Sahar Ali, one of the doctors here in the GP surgery. Are you Mr. Paul Bernard? Yes, doctor. Okay. Nice to meet you. Can I confirm your age, please, if you don't mind? Yes, 28. Okay. Thank you for coming today. I can see from my note that you are coming because of a problem in your eyes. Is that right? Yes, doctor. Okay. I'm really sorry to hear that you have a problem in your eyes. Can you please tell me more about this, please, if you don't mind?
Mm-hmm. Yours is much better. Yeah.
Okay. Confidence.
Organized. Mm.
Yes. So
Mm.
in my head, I'm aiming to introducing myself, confirming the
Mm-hmm.
patient name and age, acknowledge and tell him
Mhm.
that, or telling him that I've read in my notes that I'm a caring doctor, okay? And I
Mhm.
know some of the problems that he has,
I
okay?
see.
It's I'm always doing that. I don't say
Mm.
how can I help. It's okay to say how can I help, okay? But it's
Mm.
better to tell him, well, I can see that you have a problem in your eyes, that right? Yes. Can you tell me more about that, please?
I see. Yeah. Yeah, you are right. Yours is much,
Okay,
much better. Yeah.
all right.
Yes.
So
Yeah, thank you.
this is the thing that you have to bear in mind. I'm introducing myself, confirming, and showing that I read, I'm caring doctor, okay? Acknowledge that there is a problem in his eye, and then ask him, can you tell me more? Okay,
Okay. Got it. Thank you.
thank you. And you can add, you can tell him, well, before telling him, can you tell me more? You can tell him, well, I'm here to ask you a few questions to reach what's the problem exactly. Okay,
Mhm.
can you tell me more about this? You say the purpose. Okay,
Mhm.
so
Okay.
whatever you want. If you don't want to say the purpose, it's okay, but always make sure that you fulfill these three main things: introduce, confirm, acknowledge. All
Okay.
right.
All right.
Okay, thank you, Dr. Sarah.
Thank you.
Well, this is the first case. Any question in this case? Any idea? If you have an idea, please share with us. We are discussing. We can see different ways of starting the station. Anyone can share his ideas how to start the station perfectly? No sharing? Okay, sharing is caring, doctors. Please share, all right? Yeah. So let's do the next station. Who is ready? Who wants to practice how to start a case?
Okay, Dr. Sahar, me, Iman.
Dr. Iman. All right. Please, doctors, anyone who wants to switch his camera or her camera on, please do that. It's better for everyone here, okay? But no force. I don't force anyone to switch their cameras. Okay, let's do the next case, Dr. Iman. Please read the question.
Okay, I'm ready.
Ready?
Yeah.
Okay, start.
Hello, I'm Dr.
Hello?
Iman. I'm Dr. Iman, one of the junior doctor in the surgery today. Would you confirm your age and your name and age for me, please?
Yes, I'm William Harat, and I'm 55 years old, doctor.
Thank you, William. Is it fine to call you William?
Okay, yeah.
Oh, okay. I don't have any notes for you apart from your blood pressure reading, okay? Uh,
Okay.
so um, if you have any concern, I'm really happy to address any concern you have.
Yes, doctor. To be honest, yes, I've arranged for this appointment because I have a problem which is concerning me lately.
Yeah. So may I know it?
Well, I've been having some um confusion episodes lately.
Oh, confusion.
Yeah.
Yeah. Just tell me more about that. What you mean by confusion, William?
Well, to be honest, I was playing with my friend in the two occasions. And while I'm playing, he told me that you had few minutes of talking nonsense, confused.
Yeah. So you mean that you have lost your consciousness in this time?
No, I didn't lose my consciousness. I was just, you know, talking nonsense. I was not aware of what's going on.
Yeah, and talking incomprehensive words like this.
Yeah.
Well, okay, but you did not fall down, you did not have any syncopal attacks like this, no.
Can you say that again, please?
And no falling down, and no
No,
syncope, no loss of
no.
consciousness. Yeah,
No.
okay, quite well, quite well.
Okay,
Okay,
thank you. Thank you, Dr. Iman. All right, how do you feel?
I feel nice.
All right. Yes, you started the station very well, which is good, to be honest. Okay. The only thing that I can comment, and I didn't comment on it with Dr. Sarah as well. Um, uh, uh, this is my point of view. I don't know if it's you know, if it's you know, if this bother the patient or not, but I don't like, or I don't prefer to say to the patient, can I call you blah?
Yes. How would I call you? How would I call you?
It's always better to say, what would you like me to call you?
How would I call you?
Yeah, what would you like me to call you? What
Yeah,
would you like me to call you? What would you like me to call you?
yeah.
Okay, why? If you say, can I call you this? You are just telling them, I'm comfortable by saying this only.
Yes,
Okay?
yeah.
You are telling them, or you're giving them order that, please tell me it's okay. This is my
Yeah,
perception of this.
right.
Okay? It's better to say, what would you like me to call you? If you would like to say something like this. Okay?
Yeah.
And always this phrase is important and crucial in trans patients.
Oh, yes, yes.
If you don't say that in all of the cases, it's okay. But in trans patients, it's extremely important to say, what would you like me to call you? Not, can I call you blah? No. What would you like me to call you? Okay? All right. So yes, it was a nice start, to be honest, Dr. Iman. So you started introducing yourself, confirming confirming the patient's name and age, and then you told him what you've read. You told him, okay, I can see that you have some concerns. All of what I have is the blood pressure reading, which is really nice. Okay. Um, um, and then you told him, okay, can you please tell me what's going on? Okay, but the only thing is, can I call you?
How to call you? Yes.
Yeah, all right. So yes, this is a suggestion from Dr. Iman, a suggestion from myself. Hello, how are you? Are you Mr. I'm Sahar Ali, one of the junior doctors in the GP clinic. I'm looking after you today. Can I confirm your name, please? Can I confirm your age, if you don't mind? Okay. Well, I can see from my note that you have made an appointment to see me today, and I can see also that they have done some blood pressure, and the blood pressure reading is with me. But can you tell me what's concerning you today? I'm here to address all of your concerns. Okay, this is another idea to start the station. Okay. Well, okay, good. So, good attempt, Dr. Iman. Anyone else for the next case? Anyone else? We have many doctors, start doctors. It's just, less than 1 minute. We are going to start you know, complex cases now. Okay? So please take this opportunity. Anyone?
Okay, I can share again.
Who is Dr. Iman?
Yeah.
All right, no worries. Okay, let's do the next case.
Okay, Dr. Omar, no problem. Okay, okay.
Who is there a problem?
I think there is another doctor wants to share.
There's Dr. Ithar.
Is that? Oh, yes.
Dr.
Yes,
Ithar,
doctor.
you raised your hand. Do you want
Yes,
to?
yes. Yes, I can have this opportunity. if
Okay,
it's
no worry.
Dr.
Yeah,
Iman.
you can. Are you happy, Dr. Iman, for Dr. Ithar to do?
Ah, yes, yes, doctor, no problem. I just shared because no one
Okay,
wanted to
no
share.
worries.
Yeah,
Okay.
Great, thank you, Dr. Iman.
you're welcome.
All right, but can you just raise your or speak loud a bit, Dr. Ithar, because I barely can hear you.
So, how's right now? Is it okay?
Better, a bit better.
All right.
All right, so let's do done this. Yeah, read your question.
Okay, I'm ready.
Ready? Okay,
Yeah.
start.
Hello, good afternoon. My name is Dr. Amr, one of the doctors working here in the GP department. Am I speaking to Maria Frog?
Yes, Dr. Maria Ford, yeah.
So, how would you like me to call you?
Maria is okay, doctor.
Right. So, may you confirm for me your age, please?
I'm 45.
All right, nice to meet you. So, I can see from my notes that you came with headache. Is that right?
Yes, doctor, I have headache.
Oh, I'm really sorry to hear that. So, could you tell me more about that?
Well, doctor, it started 3 days ago and it's getting worse.
Oh, all right, we're going to go through this step by step. So, is it the first time for this to happen?
Yes, doctor.
And could you think of anything that might have triggered it?
Not sure, doctor. Thank you. Okay.
You're welcome.
All right. Thank you, Dr. Ithar. Thank you so much. How do you feel?
I don't know because like I started out of a sudden, I was not prepared for it.
Okay, no worries. Okay, so do you think that you missed something
I
in your
think
start?
I don't know.
We have three main points in the introduction: introduce, confirm, and
Mm.
acknowledge.
Oh, right, all right.
Acknowledge. Did you acknowledge, or did you pick, or did you highlight that I am holding my head? I can see
No,
that you are a bit uncomfortable.
no.
Picking up the non-verbal clues.
All
Okay?
right.
If you
Yes.
don't do that, believe me, the patient will not be comfortable with you. Okay?
All
So
right.
always, always, always, once you start by introducing, confirm, and acknowledge. Okay? So uh, once you saw the patient is uncomfortable and in pain, try to lower your voice a bit to match the situation. It's inappropriate to be enthusiastic and smiley in this case.
All right.
Got me? So
Yes, yes, got it.
do you know now the differences? When can I smile? When I'm not smiling? How to acknowledge and when to acknowledge and these things? So it's very important. You might say, okay, it's the start of the case. What's the problem in that? but actually it is the most important part in the case. Okay?
Mhm.
So it's very important to start the station properly. In this station, you can say, once you see, so you start, hello, how are you? And once you saw the patient is like this, okay, I'm Dr. Sahar Ali, one of the junior doctors here. Am I talking to Maria Forge? Yes, doctor. Okay, can I please confirm your age if you don't mind? Yes. Okay. Mrs. Forge, I can see that you're holding your head and you are having discomfort, you are uncomfortable, and I can see that you have headache as well. Can you tell me more about that? I'm really sorry to hear that. Can you tell me more about that? Okay,
Mhm.
so acknowledge
Mhm.
and then ask, can you tell me more?
All right.
All right, so
Mhm.
you missed acknowledgement, Dr. Ithar. Okay,
Okay.
was it helpful?
Very helpful.
All right. Okay, let's do the next one. Who is ready? I can see here Dr. Iman, Dr. Fatima, Dr. Peace. Okay, Dr. Fatima, ready? You want?
Inshallah.
Inshallah. Okay, so let's do this. Read your question, please.
Okay, I'm ready.
Ready?
Can you hear me correct?
Start.
Okay. Hello, I'm Fatima, one of the F2 doctor in the medicine department. Are you Mr. Paul Bernard?
Yes, doctor.
Hello.
Hello.
So I believe that you are 55 years, right?
Yes, doctor. I'm 55 years old.
Okay, Mr. Bernard, from my notes, I can see that you've been admitted here 4 days ago because you're having some heart attack. Is that right?
Yes, doctor. Yeah, but thankfully I'm going home now.
Oh, that's good news.
Yeah,
I'm very happy that you are doing well now.
thank you.
Okay, and how are you doing right now? Is everything all right?
Yeah, I'm okay. Yeah, everything is okay with me. Happy to.
So you are okay. So you are excited for a discharge. I can
Yeah,
see that.
yeah.
Okay, that's good. That sounds very good. So from my notes, I can see that you've been prescribed some medications like aspirin and bisoprolol, simvastatin, and clopidogrel. Is that right?
Yes, yes, and they explained to me how to take them. Yeah.
Okay, okay, that's good. That sounds very good. So I'm here to talk with you about your lifestyle. Would that be all right with you?
Uh, well, okay, yes. Why are you going to talk about my lifestyle, doctor?
Uh, just a part of the rehabilitation process and to prevent any heart attack in the future. Also, I would like to catch if you have any concerns for me right now.
All right. Okay. Okay.
All
Thank
right.
you. Thank you, Dr. Fatima. Thank you so much. How
Thank
do you
you.
feel?
I don't know. You can tell me.
All right. Okay. So you started the station in an enthusiastic way, which is good, and you introduced yourself, you confirmed the patient name and age, and you used the information in the question, which is good. I would prefer if you start by the discharge instead of the
Okay.
admission.
Okay. Okay.
All right. I think it's better because, you know, the admission is just admitted for heart attack. Okay,
Uh-huh.
which is not a very good, you know, it's not a very good thing to talk about. Okay.
Okay.
But the discharge going home is better to talk about. Okay.
Okay.
So this is the thing. You you told him I'm going to talk about lifestyle, the purpose of the consultation, which is good, but it's better to explain what, you know, don't tell the patient right away I'm going to talk about lifestyle. What's the aim of talking about lifestyle? You can tell him before you are going home. Okay, I'm going, if it's okay with you, I need to talk or have a talk with you about how to minimize the risk of having a heart attack in the future. And
Okay.
one of them is lifestyle modification, if you don't mind.
All right. All right.
Okay, so this is, you know, the better explanation or better introduction or better explanation of the purpose of the consultation. Okay?
Okay.
So
Okay.
yes, you fulfilled the four aspects of starting the station properly. Introduced yourself, confirmed, and uh, nothing to acknowledge, to be honest, but you used the information in the question and you told him about the purpose, okay? But it could be better than that. All right?
Okay. Okay.
Yeah. Okay. So instead of
Mm.
talking about the hospital admission, talk about the discharge. And instead of telling him lifestyle, tell him the main purpose. So I'm here to have a chat with you about how to minimize the risk of having any heart attack in the future, and one of them is lifestyle management.
Okay. Thank you, Dr. Sahar. Thank
Thank
you
you,
so much.
Dr. Fatma. Sorry? Who is talking? All right, no worries. Okay. So, yes, so this is in terms of the start of this case.
Dr. Asahab, please.
Yeah.
Can we say, I hope you had a nice stay, for example, had a nice stay in the hospital or in the department or so?
Yeah, it's okay. It's fine. Yeah.
And then to ask him about any problem he faced during his stay or so?
You can say that. It's fine. You know, whatever you prefer and you feel it's appropriate, it's fine. But to be honest, maybe he has yeah, it's fine. It's fine to say how is the hospital stay and these things. Yes, it's fine.
And
No problem.
no need at all to ask about any symptom he had for admission, right? No need at all.
No need to ask about the symptoms before the admission. You just
Yeah.
tell him or to check, you check on him. How is he now?
Yes.
Okay? This is a counseling case. If you start the station, can you tell me what happened before the admission? This will not help you at all. It's not the purpose of the case. Okay?
Yeah.
All right. Okay, so we have talked about the start of this case. Just bear with me, doctors. I just need to bring the charger, if you don't mind. Right. Okay, doctors. Let's do the next case. Who is ready? We can repeat the cycle. Dr. Sarah, you are here. Dr. Sally, Dr. Ithar
Yes, I am
again.
here.
Yes, and Dr. Ahmed Samir. You can practice, doctors. It's just, it doesn't take time to do the, it's just 1 minute. Okay. Take the
Okay.
opportunity, please. All right, Dr. Sarah.
Yep.
Okay. Let's do the next one. Read your question, please.
Okay.
Cases will be more difficult
Yes.
when we reach the end of the cases. I can see people are leaving because they feel like it's the start of the station. No,
Oh,
it's
yeah.
really important. Okay.
I will try my best. Okay, let's
Yeah.
start.
Yeah, you can start.
Okay, hello. I am Sarah, one of the junior doctors in this GP clinic. Can you confirm your age and name for me, please?
Yes, doctor. I'm Maria White and I'm 25 years old.
Okay. How may I call you, Mary? Please.
I'm Maria. You can say Maria is fine.
Okay, thank you. Nice to meet you, Maria. Actually, I am calling you regarding your blood tests
Yeah.
that you did a few days ago.
Mhm.
Is this a suitable time to talk to you?
Yes, doctor. Yes, it's suitable for me. Yeah.
And is it the best line to use if the line got disconnected?
Yes.
Okay, thank you. Maria, do you have any expectations of your blood tests?
Well, nothing, doctor, because I know I'm just waiting. I just want to know what are the blood tests, to be honest.
And do you have any idea of what that test was for?
Yes, they told me it's for the liver function.
Mm-hmm.
Yeah.
Okay, all right. Good. So I have your results with me now, Maria, and we have something called liver enzymes. And from what I see from my notes here, it's quite elevated,
Thank
especially
you.
the,
Thank
yeah,
you, Dr. Sarah. Thank you.
okay.
Okay, good. So, how do you feel?
Yeah, I think this one is better than the first one.
Yeah, you introduced yourself, you confirmed the patient identity, you ask her, what would you like me? Yes, you were a bit like, what would you like me to call you, Maria? So, yeah. Okay, it comes with practice. And then you told me what is the purpose. In the confirmation, please don't miss the confirmation of the first line of address, please. Yeah,
Oh, yeah.
yeah.
Okay.
This is one of the confirmations in the phone consultation. What else you missed? You didn't ask me why did I do these tests.
Oh,
Yeah, okay.
yeah.
So you told me you did some blood tests and what's your
What do you
experience?
think it was for? Yeah.
Yes, you did that,
Mm.
but it didn't tell me why you did them. Okay.
Oh, I see.
Yeah, so these are the things that you missed. So a good start for this station. Introduce, hello, how are you? I'm Sahar Ali, one of the junior doctors in the GP clinic, or I'm calling from the GP. Can I please confirm your name? Maria White. Can I confirm your age, please, if you don't mind? Yes. Is it the best phone number to call you if the lines are disconnected? Yes, doctor. All right. Can I confirm the first line of address if you don't mind? Yes. Okay. So I believe that you've done some blood tests, and they are with me now. I'm going to explain them to you. But can you please tell me why did you do these tests in the first place? And do you know what
Yes.
are they for? Okay, so you can.
Okay.
This is an idea. You started the station very well, but you just missed these 2 points that I talked about before.
Okay, but I have a little question. It's about the address part. I think it doesn't, yeah, it does make sense, but if it's a must, they must put it in the notes, right?
It will be in the notes in the exam.
Okay. Okay.
Yeah, it will be in the notes.
Okay. Okay, thank you so much.
Thank you, Dr. Sar. All right. Okay. So let's do the next one.
Okay, I can do the next one.
Who is?
Dr. Ahmed.
Dr. Ahmed. All right. Okay, let's do the next one. Read your question, please.
Okay, I'm ready to go.
All right. Yeah.
Hello, my name is Dr. Ahmed. I'm one of the doctors here in the surgery. Am I speaking to Mr. Jack Smith?
Yes, doctor.
May you please confirm your age?
I'm 48 years old.
And what would you like me to call you today?
Jack is fine, doctor.
Okay, Jack, nice to meet you today.
Thank you.
I can see here in my notes that you came today for a pre-operative assessment. You have a screw in your need to be removed. Is that right?
Yes, doctor. Yeah.
And can you please tell me about your last operation? I think it was a year ago. Is that right?
Yes, it was a year ago, and yeah, it went well. I don't have any problem, but the surgeon told me we have to remove the screws just because it's irritating the tendons around, so I have to remove it.
Okay, it's good to hear that you don't have like any problems. You don't have any pain or swelling or numbness at all. Is that right?
No, I don't have anything.
Okay, that's good to hear. And may I please ask you some questions, and then I would need to examine you. Is that all right with you?
All right. Thank you, Dr. Ahmed. Thank you so much. Very good. Very good start. Calm, relaxed, confident. Use the information in the question. I would prefer if you tell him, I'm going to ask you a few questions and examine you as part of the assessment
Okay.
before the surgery. Okay? This is the only thing that you can add. The
Dr.
purpose.
Sahab,
Yeah,
please.
yeah.
Pre-operative. Can I say that? No problem. I believe that you come as a pre-operative assessment. This is not considered as like a jargon or so? Or no problem?
No, they know operation. They know what is the meaning.
Pre-operative, like pre and post, like this. This is not.
No. They know. They know here in even the prefix and suffix.
Yes, they know that.
They teach them in the schools. Yeah.
Okay.
So
yes.
if you feel like you're uncomfortable to say them, so you tell him assessment before your operation
Yeah,
or
I
assessment
think
before your surgery.
this is I wanted to ask about.
Yeah, whatever you prefer, it's fine, but preoperative is okay. All right.
Yes.
Even if you say it and the patient tells you, what do you mean, doctor? Then tell him, I'm sorry if you don't, if I used something which is not, you are not familiar with. Preoperative means that assessment before your surgery. That's it, confidently, without any hesitation. All right. Don't feel like this thing will fail you. No, there are many things to be done in the case, and has marks on them. And instead just focusing on, I did this wrong thing, then I will fail. No, it doesn't work like this. All right. Okay, this is a surgical counseling case, and we had an idea about how to start a case of surgical counseling and how we use the information in the question. Okay, thank you, Dr. Ahmed. Let's do the next case. The cases are now getting difficult, okay? Yeah, who is ready? Who is ready to be the victim in this case? Anyone? Dr. Sally.
Hello, doctor. How are you?
I'm fine, Dr. Sally. Okay. I'm happy that you're challenging yourself.
Thank you.
Let's go to the next case. Read your question.
Okay. Okay, doctor. I'm ready.
Ready?
Yes.
Start.
Hello, I'm Dr. Sally, one of the junior doctors here in A&E.
Who are you?
Can-
So sorry? Junior doctor? I don't want to talk to a junior doctor. Where is your consultant?
Okay, they are here. We are all here to help you. But just a few
Okay.
questions to know what is going on, and if there is anything that needs this consultant to be here, he will be here, right?
Okay, please bring your
Is that
consultant.
okay with you?
No, it's not okay. I want to talk to the consultant.
Okay, top. Okay, just I wish I take up to know about the problem to tell the consultant about it. Can you tell me what's going on right here?
I'm not going to talk to you.
Okay, can I just know your name, please?
Sorry?
Can I just know your name, please?
Albert. My name is Albert.
Okay, Mr. Albert. Can you confirm your age?
I'm 50.
Okay, Mr. Albert, I know from notes you were here for a surgery 3 weeks ago. Is that right?
Yes, it is right. And I have an infection in the surgery. And I'm not going to talk to any junior doctor. I need the consultant who did the surgery.
You have all the right to talk to consultant, and we are all to help you. Just a few questions to know what's going on, to have a better picture to help you.
Okay. Thank you, Dr. Sally. How do you feel?
I don't know.
All right. Okay. What do you think that you missed doing in the start of the station? We have 4 main, or let's say 3. The 4th is the purpose of the consultation. Some people don't talk about the purpose, which is okay. It's not the big deal, but there are main 3 points in the introduction, and you missed one of them.
Oh, it's the first thing I didn't ask for the name and the age,
You
but he didn't
introduced
give me the
yourself?
chance. He didn't give me the chance at the first to ask about his name or his age.
Yeah. So the third one, what is it? And you didn't do it. You didn't do it. Acknowledge.
Yeah.
Acknowledge. Acknowledge that he is angry or upset.
Yeah.
Okay? If you don't acknowledge, especially the angry patient, or the patient who is refusing, or the patient who is unhappy, or the patient who is looking down or doing anything as a verbal or non-verbal clue, please pick it up. Acknowledge. You look very upset, Mr. X. Or I can see how you are upset, Mr. Green. I'm here to talk with you. I can see that you are concerned and want to talk to the consultant. The consultant is not available now. I am one of the team, and I'm here to address all of your concerns, and then I can transfer all of your concerns to the consultant. Okay? If you don't acknowledge, the patient will be unhappy till the end.
Yes.
Okay? If he says sometimes he doesn't give you any chance to talk. This is one of the stations that the people just, you know, stare and, oh, what should I do now? Okay? So who are you? Who are you? You tell him, hello, I'm Sahar Ali, one of the junior doctors here, or one of the doctors here. Junior doctor? I don't want to talk to a junior doctor. Where is your consultant? Then, okay, I can see that you are very upset or extremely upset, Mr. Green. Green, right? Are you Mr. Green? Albert Green? Yes. Okay. I can see how you are extremely upset. There's upsetting you. I'm here to address all of your concerns. I'm one of the team, and the consultant is not ready now. He's not available, unfortunately, but I'm here to address all of your concerns. Can you please tell me what is the reason behind this upset? Can you see
Yes, doctor.
the difference? All right. Acknowledge.
Mm.
All right.
Yeah.
Okay. And be confident. You have to introduce yourself. Introduce yourself. Okay. And then tell him, well, I just want to confirm that I'm talking with the right person. Mr. Albert Green, right. I can see how you are extremely upset, or can you see the facial expression? You look very upset, Mr. X. I can see how you're upset. Can you please tell me what is the reason behind this feeling?
Yes.
All right. Okay. And you addressed the concern of consultant. I understand that you want to talk to the consultant. The consultant is unavailable right now, and I'm here, one of the team, and I'm going to address your concerns and let the consultant know about them. If he is insisting, no, I'm not going to talk to you, I want the consultant. Tell him, well, I do understand that you really need to talk to the consultant. While the consultant is available, just please tell me what are your concerns, and then just to make things forward or to move things forward.
Okay, doctor.
Okay?
Okay.
Do you want to do another try?
Okay.
Okay? Let's do it.
Okay.
Let's do it. Okay. Start.
Hello, I'm Dr. Sally, one of the junior doctors here in A&E.
Junior doctor? No. I don't want to talk to any junior doctor. Where is your consultant, please?
Well, I can see that you are upset right now, but just to confirm I'm talking to the right person. Can you tell me your name, please?
I'm Albert Green.
Can you confirm your age, Mr. Green?
I'm 50. Can you please bring the consultant?
Okay, Mr. Green. I see you are concerned to talk to our consultant, but he's not available right now. Just let me know what is the problem and what is going on to help you with that.
Okay. What do you want to know?
I see from my notes that you had a surgery 3 weeks ago here in our hospital.
Thank you, Dr. Sally. Okay. So much more better. You just need to play a little bit with your tone of voice. Okay. But
Yeah.
it's much more better. Okay. With
Thank
the
you.
practice, you will get to do that. What if the patient is standing up once you enter the cubicle?
I will stand up. You just be.
You will be standing, okay? And you offer him, can you please have a seat? Okay, I know that you are very upset, but can we have a seat and then we can talk about your concerns? I'm here to address all of your concerns. Don't worry, all of your concerns will be addressed.
Yes.
Okay?
Okay.
If he doesn't want to sit down, it's okay. Talk, carry on talking, and then offer again. All right?
Yes. All right.
Don't insist just for him to sit down. Carry on just few words, few sentences, and then, okay, can we have a seat now? All right? So,
All right.
yeah, good. Someone is raising his hand. Is it me or? I don't know.
Yeah.
I didn't raise my hand. Okay, no worries. Okay, any question in this case, doctors? Any question?
No, everything is okay.
All right, good. Let's do the next one. In this case, so you introduced yourself, you confirmed, you acknowledged, okay, and then you talked about the purpose. What is the purpose? I'm here to address all of your concerns. Okay? All right, and you stay calm. You stay calm and relaxed. Whatever the patient does, or if he is raising his voice, you still calm, relaxed, and clear and firm in the same time. All right? Being firm, this is at the end, I mean, in the management, okay? But if you be firm at the start, this is not good, okay? All right. Let's do the next one. Who is ready for the next one? We need another victim. Dr. Ilaf. Dr. Ilaf?
Assalamu alaikum.
Alaikum assalam. A nice name.
Thank you.
All right. Okay, Dr. Ilaf. Do I say the name correctly?
Yes, Ilaf. Yes.
Ilaf Quraysh, right?
Ilaf Quraysh. Yes.
Okay. Okay. So let's do the next case.
Okay.
Read your question, please.
Where is it?
Once you're ready, tell me, please.
Okay. So Yes, I can start. Yes, just I have a noisy background. Okay. Okay, I'm ready, Doctor.
Yeah, start.
Hello, my name is Dr. Bilal. I'm one of the doctor in the pediatric department. Are you related to Alex Brown?
I'm his mom, doctor. Please tell me, is he okay? How is he doing? Please tell me, doctor.
Okay, I can see that you are very worried about your Alex, but let me tell you, we are looking after him as much as we can. Okay?
Okay, doctor. Okay.
Okay. So before that, I would like to confirm few details from you. Could you confirm his age for me, please?
He's 5 years old, doctor.
Okay, thank you. So could you please tell me how can I call you today?
Call me Maria.
Maria. So Maria, are you're on your own or you have someone with you today?
Yes, my husband is here in the hospital in another room, doctor. But yes, please tell me, how is he, doctor? Please, please tell me.
Okay.
Is he going to die?
Oh, I'm really sorry that you are feeling this way, but we are looking after him as much as we can, so don't worry at all. Just I would like to ask you a few questions regarding his medical condition, to explain about his test result. Okay?
Okay.
Okay.
Thank you. Thank you, Dr. Ilaf. How do you feel?
شوية hesitant or not? I don't know.
No, you were confident, relaxed, calm, and you introduced yourself, acknowledged that she was worried. You reassured her it's one of your parts in this case to do in the introduction. Acknowledge and reassure her, and then confirmed her name and the age of her child, and then you told her the purpose of the consultation.
Okay.
Okay, good, well done. Are you practicing daily or this is the first time?
I did not have a study partner actually. I'm
Mhm.
practicing, but not on daily basis. When I found anyone.
All right, good. So this is not the first time to practice. This
No,
is
no,
the
no. It's not the first time. It's not my first time. Yes.
good. So you fulfilled all of the points, and you addressed one of the main points that you should have to do, or you should do, is the acknowledgement of her worries and reassuring her. Good,
Mm.
good, very good.
Thank you. Thank you.
Thank you, Dr. Ilaf.
Thank you
All
very
right.
much.
So
Thank you.
nothing to add, to be honest, in the case. So she just fulfilled all of the main points. Okay. Let's do the next case. Any question in this case? No questions? Good. Let's do the next one. Who is ready? Who is ready, doctors? There are people who are joining. Dr. Whom? There's Dr. Amin, Dr. Ithar, if you want to do another one. Dr. Harika, Dr. Rasha, Dr. Yathrib. Yeah, nice names, doctors, to be honest. Yeah. Anyone? We still have 4 more. Yeah, 4 more cases. Dr. Riham? Okay. Let's do with Dr. Riham. Ready?
Yes.
Okay. Again, if anyone is joining us just a few minutes ago, if you want to switch your camera on, please do. This will help me to give much more, insight or idea about your facial expressions and body language. Okay, let's read the next question. Please read your question. When you are ready, just tell me.
Okay, ready?
Ready?
Yes.
Okay, start.
Hello, Dr. Rihan Mahjoub, DMC number 12345. May I proceed?
Yes.
Hello, my name is Dr. Rihan Mahjoub. I am one of the treating doctor here in general
Doctor, thank you for
medicine.
coming. Thank you for coming today because I don't want to take this rat poison.
I understand that, but please, could you confirm your name, please?
I'm Sally Black,
Okay, Sally Black. Could you confirm your age, please?
55.
Okay, Sally. Could you tell me how can I help you?
I don't want to take this rat poison.
I understand that you are worried regarding this, but could you tell me why? Is there any specific reason?
I told you, doctor, it's a rat poison. Why do I need to take rat poison?
Well, I understand that you are worried regarding this, but I reassure that it will not harm you. I understand that you also come with some complaint like shortness of breath and palpitation. Could you tell me how are you now?
I'm okay now.
Well, for that, I see that you are improved now, but we are expected to give you warfarin. What do you think about it?
No, I don't want to take it.
Is there any specific reason?
I told you it's a rat poison.
I understand you are worried about it, or your worries are appreciated, but it had much better to improve your condition, so it will be better to receive it.
So why are you giving rat poison to the patients? How should I improve on this rat poison?
Well, I understand you are worried regarding this, but let me assure you, this is not rat poisoning. It's a treatment to help you to get better improvement.
But I have read before that this warfarin is one of the rat poisons.
I see that you are right about it, but it's not rat poisoning. It is treatment. It is type of blood thinner medication. He will improve your condition, and you will be better soon after giving it.
All right. Thank you. Thank you, Dr. Rihan. Thank you. How do you feel?
Hesitant.
Okay, and why do you think that you were hesitant?
I think I didn't perform well.
You didn't?
Yes.
You didn't what? I didn't see.
I didn't perform well.
Okay, and from where the lack of performance comes? Like, what made you hesitant?
Actually, because this case, I didn't read about it.
Okay,
This is the first time for me.
you didn't practice before on refusing patients?
No.
No. Okay. So are you starting your preparation?
No. My exam after about 2 months.
Okay, in the middle. So you are in the middle of your preparation, right?
Yes.
Yeah. Okay. Good. Okay. So all right. So are you practicing every day or
Yes, I practice every day.
Okay. Good. good. Okay. Did you start dealing with ethics cases or not yet?
Yes, I did many chapters in ethics,
Okay.
like breaking bad news.
Good. All right. So, well, okay. This case is one of the ethics cases. It's dealing with refusing patient. Yeah. Well, to be honest with you, you introduced yourself and you confirmed the patient name and date. You acknowledged that she is refusing the medication. Okay. But you didn't do that properly. What does that mean? I can do everything, but still the performance needs improvement. Okay? You acknowledged, but you didn't reassure, you didn't explain to her that this is not a rat poison from the start. You told her, well, it's a medication to improve your condition. She wants a clarification about this part, rat poison. Okay? You can tell her, okay, well, okay, this is one of the most common concerns of the patient. Warfarin, we can be rat poison, okay? But in medicine, in the hospitals, we give it in another dose, which is one of the doses to help patients to be better. All right? So this is how to address this, okay? Or you can tell her, okay, I can see, or I can see that you are worried about warfarin and you are telling me that it is rat poison. So from where did you get to know about this information? How much do you understand about warfarin? Okay, so this is how to deal with this concern. All right, she has this specific concern and you are trying to tell her this is a medication to help you, but you didn't answer this question. Did you get what I mean, Dr. Riham?
Yes.
Okay, so this is the active listening. This is the active listening. I'm listening to understand what the patient wants to convey exactly, and then I explain based on this concern. She's concerned about this medication could be, she heard or she know that it is rat poisoning. So how I'm going to reassure her? The answer matters. All right? So you fulfilled all of the points of the introduction, but you didn't do them properly. Okay? Don't feel bad at all. This is like, you know, we are practicing. We do mistakes to learn. Okay? If I did a mistake, if I didn't do very well in the practice, this doesn't mean that I'm lacking many things. No, it means that there are some techniques to understand, then I will be better and better. Okay? Thank you for your participation, Dr. Riham, and thank you for doing these mistakes, because if we don't do mistakes, we don't understand better what are the issues behind the cases. Okay, so in this case I will give you an idea about how to start this case. Hello, I'm Sahar Ali, one of the junior doctors here in the hospital. Doctor, I don't want to take this rat poison. Tell her, okay, I can see how you are worried about this specific concern. I'm going to address that shortly, but can I please make sure that I'm talking to the right person? This is how to signpost the confirmation in this particular case. Okay? I just want to make sure that I'm talking to the right person. Are you Mrs. Sally Black? Yes. Your age is 55? Yes. Okay. Thank you for confirming that. I'm here to address all of your concerns and talk to you about your medication. I can see that you are not happy to take this medication and you are telling me that it's a rat poison. Can you please tell me what is your understanding about warfarin, or what your understanding about this specific medication, or which medication that you, if she didn't say warfarin from the start, so which medication that you feel it is a rat poison? Okay, this is part of your data gathering. Okay, warfarin. Okay, all right, I can see that. So what's your understanding about warfarin? It's a rat poisoning, doctor, or a rat poison. All right, okay, I can see. It's one of the common concerns of the patients. Did you read about this before from any website, or from where did you get to know about that? I read it in one of the websites. Okay, good. I understand that. All right. So to be honest with you, the medication that we give in the hospitals, which is warfarin, it's totally different, totally different from rat poison. The dose is different. So this medication is safe on the patients, and we give the medication for the patients to be better. Can I ask you a few questions to be able to address all of the other concerns, or to make sure that you are fine now? Then you take your history. Okay? All right. So in ethics cases, it's always better to address the concern first, and then you take your history. Don't be concerned about taking the history first. All right? She's concerned, and she is not going to listen to you unless you address the concern. Especially in difficult refusing patients, in difficult demanding patients, in difficult angry patients. All right? Acknowledge and address. All right? Got the idea how to deal with this case? Any question? Any question, doctors?
Everything is good. Thank you.
Anyone? Dr. Riham, do you want to do it again?
Yes.
Okay, let's do it after understanding everything. Okay?
Hello. Okay. Hello, Dr. Riham Mahjoub, one of the treating doctor here in general medicine.
Oh, doctor, okay. Thank you for coming. I don't want to take that rat poison.
Well, I understand that you are worried regarding this. But before this, I want to confirm that I'm talking to the right person. Can I? Are you Mrs. Sally Black?
Yes,
Okay, could you confirm your age, please?
55.
Okay, Mrs. Sally, I understand that you are concerned regarding some medication. Could you tell me more regarding this?
This thing, I don't know, warfarin. It's a rat poison. Why do you give this medication to the patients?
I understand that you think it's rat poisoning. Is there a specific reason why you think it is rat poisoning?
Yes, I read that in one of the websites before.
Okay, I see that you read about it. But I just want to reassure you that the medication we use in hospital, which is warfarin, is totally different from you read about it. We use it in a different dose, which is totally different, and it is not harming you. How does that sound for you?
Thank you.
Okay.
How do you feel?
Much better.
Did you see now the importance of the session and the importance of starting the cases confidently, competently, with all of the clarity?
Yes.
Okay. So yes, thank you, Dr. Riham.
Thank
All
you.
right, let's do the next one. Who is ready? Who is ready? I can see people are just joining now, which is reassuring me or just making me happy that yes, my choice of the session is right, because it is important. How to start the station is important. All right, anyone?
Okay, doctor, I'll try, but I'm at work and the place is a bit noisy, so
It's fine. It's fine. Don't worry about the noise. I will manage.
okay, thank you.
Who is Dr. Amin? Okay.
My camera is on.
Okay, I can see you.
Yeah.
All right, let's do the next one. Read the question, yes.
Okay.
Mesaj atamıyor ya bana böyle. Derdi var. Kalın artık yazma. Engelledim. İyi ya. Yazma. Bu kanalda oluyor ya. Sana dedim. Gerek çıkarmamıştım.
When you are ready, tell me.
Okay, doctor.
No.
Let me look it. Okay, I'm ready, doctor.
Okay, all right. Start.
Hello, Dr. Amin, James number 1899974. May I proceed?
Yeah.
Hello,
Hello.
I'm Dr. Amin. I'm one of the FY2 doctors in general medical ward.
Finally, you are here, doctor. Finally, you are here. I want to go home.
Okay. I'm sorry to hear. Please pardon me. Is there any reason why you want to go home?
The nurse is not letting me to go home. I want to go home. I'm not happy in this hospital.
I'm sorry about that. That's understandable. But please bear with me, and I'll be as quick as possible. Is that okay?
What do you want to know, doctor?
Okay. So before we proceed, I would like to confirm your details. And please, can you tell me your name and your age?
I'm Emma Robinson, and I'm 27 years old.
Okay. For the purpose of this consultation, is it okay to call you Emma?
Call me Mrs. Robinson.
Okay, Mrs. Robertson. So understand that you were being admitted in the hospital a week ago, and now you are ready for discharge. Am I correct?
No, I'm not ready for discharge. They don't want to let me go home.
Oh, is there any reason why they don't want to let you go home?
They told me that I have a problem in my heart and it's unsafe to go home.
Oh, okay. I'm so sorry about that, Mrs. Robinson. In order to get a better understanding of that, I would like to ask you some questions. Is that okay for you?
I'm fine. I don't feel any problem. Just let me go home. I want to have a cigarette.
Mrs. Robinson, I understand this can be very disturbing for you, and this can be a very difficult situation for you. However, in order to get a better understanding of what is going through, I need to ask you a couple of questions to know what is going on.
I told you, doctor, what's going on. I want to have a cigarette.
Okay, is there any reason why you want to have a cigarette?
I didn't have any cigarette in this hospital. I use cigarettes every day. Okay, since I'm here, they don't let me go even outside the hospital to have any cigarette.
Oh, yeah, Mrs. Robinson, I know this is quite a difficult situation for you. And at the moment, you know that your situation can be critical. That's why you are not allowed to take cigarettes right now. But please bear with me. We'll be as quick as possible, and you can take your cigarettes soon.
So are you going to give me time to have a cigarette?
Well, I don't really know what is going on right now. So in order to give you the cigarette, I would like to talk to you about your condition right now.
How you are a doctor and you don't know about my condition, doctor?
So I know you have been you've been diagnosed with a medical condition and you are ready for discharge, and I need to address some concerns. And your concern is to take cigarettes. Am I correct?
Yeah.
Honestly, I don't know.
Okay. Thank you.
This quite difficult, doctor.
Yeah, it's fine. It's fine. Thank you so much. Thank you for this trial. So can you read the question? Why did you where the understanding of your the question, is it because self-discharged? You told me.
So the question is, please talk to the patient, assess the reasons for discharge, and address her concerns. Okay, so this is a self-discharge. Okay, we are not discharging her. Okay.
Yeah.
Okay.
All right. So it's self-discharged.
Okay.
All right. So it's thank you for doing this mistake. Reading the question. Reading the question carefully is important to understand what is the situation and to deal with the station properly. You can tell me, I can see that you want to go home or to be self-discharge yourself.
Okay.
Okay. If you want to use the discharge part. Okay. So
okay.
FY2 in the general medical ward, Mrs. Emma was admitted to the hospital a week ago. The diagnosis is infective endocarditis. She is required to stay in the hospital. So everything is written to you for you. To receive IV antibiotics for a few more days. Okay. The patient wants to be self-discharged. Patient has already talked to the nurse and want to talk to a doctor. Okay. So
okay.
It's written everything about the patient's condition. So there is no reason for you to say, to understand more about your condition.
Okay. Yeah.
All right. So you introduce yourself and you confirm the patient identity and you acknowledged that I want to go home. All right. But you didn't that properly in the context. You were not aware what is the question exactly. You didn't know the situation exactly. Right?
Yeah.
Okay. So it's very important to know what is the situation and what is needed from you to be able perfectly. All right. But it's try, to be honest, Dr. Amin. So when is your exam?
In 2 months, 15th of August.
Okay, good. You still have time. And did you do you practice every day?
I started serious practice. That was a week ago. But I tried to practice more.
Yeah. Okay,
Yeah.
Good trial, to be honest, Doctor. I mean, with the noises around you and the distractions around you, it's
Thank you so much. Thank you so much.
I can say, you did a very good job.
Thank you so much. Thank you so much.
Thank you, Dr. Amin. All right. Okay, I'm going to discuss the case now. Anyone wants to do another, go with the case? Anyone wants to challenge himself or herself?
Yes, me. Iman.
Dr. Iman?
Yeah.
All right. Okay. Let's do it. Once you're ready, please tell me.
The same case?
Yes, the same case. Do you want to do the same case or you?
Okay, no problem. Okay, if the same case, okay. Okay, I read it.
All right, read. Did you read it or you want time to read?
No, I finished.
Sorry?
I read it. I read it.
You read it?
Yeah.
Okay, do you want to start?
Yes.
All right, start, please.
Hello. This is Dr. Iman, a junior doctor in the department. How are you?
Finally, you are here. One of the doctors. I've been waiting for one of the doctors. I want to go home.
Okay. I see how you are frustrated. Just shall I confirm your name, please?
Emma Robinson,
Okay, Emma. And what is your age, please?
27.
Okay, that's fine. Thank you, Emma. Emma, what is wrong with you? I see that you are frustrated. What is going on with you?
I don't want to stay in this hospital. I want to go home.
Okay, I see that how you are frustrated. But shall I know if there is any reason that you want to go home?
Yeah, the nurses doesn't let me to go home, and I want to have a cigarette.
Well, that's quite understandable. You are a smoker for a long time, Emma?
Yes.
Okay. And you used to take smoking to smoke every day?
Yes, I smoke every day, but since I am here in the hospital, they don't let me to have even cigarette outside the hospital.
Oh, no, understandable, quite understandable. It must be a hard time for you. Am
It
I
is.
right? Yeah,
It is.
yes, of course, of course. Understandable, actually. Okay. So, Emma, so if you can say you can smoke here, so it is all right with you to stay?
Yes, if I can go to have a cigarette outside and then come back, it's fine.
Okay, that's great. Oh, okay, Emma. Let me tell you something that you can. We have here a smoking area. Okay, in the hospital. If I allowed you to go and to smoke, you can stay more because you know your condition needs that. So, what do you think about that? How does it sound?
All right. Okay.
That's quite well.
Thank you. Thank you, Dr. Iman.
You're welcome.
How do you feel?
I need feedback. I need your feedback actually.
Yeah. So you absorbed my anger and you addressed my concern regarding the smoking, and you were calm and relaxed, and your tone of voice was just, reassuring to me. Okay. It was good. Good. So do you hear me, doctors? Because I feel like there is a lag in my in the camera. Can you hear me, doctors?
Yes, yes, we can hear you.
All right, good, good. Okay, so yes, well done, Dr. Iman. Well done. You introduced yourself, you confirmed the identity, you acknowledged that she is unhappy, you asked her why, and you addressed my concern. If my concern is the nurses are talking about me, I don't like these nurses. They are talking about me.
Oh no, they talk about you. So yeah, what you hear? They talk about?
They are talking about me, telling themselves that I'm using heroin and I'm drug addict.
Oh, I'm sorry that it seems to bother you, of course. So Emma, I should investigate what happened, and I should ask them about what happened. Well, we should document what happened for you, and I will feedback you about what has been done. Is it
All right.
okay?
Okay. Thank you, Dr. Iman. Well, okay. Good trial. You can say I can see that it's bothering you. Okay.
Yeah.
But I will have a chat with them about what happened.
Yes.
And they are going definitely they are going to explain to you what happened. Okay. And always avoid accusing any one of your colleagues.
Yeah.
Avoid telling them, oh, it's wrong. They don't need to talk about you in that way. It's rude or all of these. No, avoid accusing your colleagues. Tell her, I'm sorry that you felt that way. You are sorry for this feeling. I'm sorry that you felt that way. All right. Well, I can have a chat with them and then we can get back to you about this matter.
Yes.
All right. And don't say document that, because this is not a mistake. Maybe the patient just has, you know, delusions, or she's manic. Okay. Because of the drug abuse. So there is no mistake just to document and to update the patient with.
Only chat. I'm going to chat with the nurse.
Yeah, I will have a chat about what happened. Maybe there is something to explain, and then we will get back to you. All right? Okay. So this is in terms of this case. Okay, doctors, any question in this case? Just for your knowledge that if the patient wants to have a cigarette or smoke a cigarette, this is his right. He can go outside in the smoker's area and smoke. No one can force the patient to do something that he doesn't want to do, or, you know, forcing. You can give him an alternative. You can tell her, well, okay, as a doctor, I know that smoking is not the best option for you. We can give you nicotine patch. It has the same effect of cigarette. If she tells you, no, I want to have a cigarette, then you can tell her, well, okay, it's your right. You can have a cigarette outside the hospital, and then you can come back. All right? Okay, and you don't need the senior thing. Okay? You don't need to say, I will ask my senior. If you ask your senior, your senior will go, tell her to go. Okay? All right. Let's do the next one. Who's ready? Who's ready? We have two stations left. Anyone? Anyone, doctors? Let's see who will say. Dr. Ilaf, another go? All right.
There is
Okay.
no one.
Yeah, no worries. Okay, let's do the next one. Read your question, please.
Peter.
Ready?
Just for you a second. His name is Peter, yeah?
Peter, yeah.
Okay. Uh, okay, I will start.
Start.
Hello, Peter. My name is Ilaf. I'm your colleague here. Could you confirm your age for me, please?
Oh, all right. Hello, Ilaf. Yes, I'm 23 years old.
Okay, thank you.
Why are
Yes,
you asking my
Peter,
age?
how are you? And how was your rotation with our department?
Well, the rotation is okay, but why are you asking about my age?
I'm really sorry for bothering you, but I want to know that I'm talking to the right person.
Well, okay. Yeah.
So how's your rotation generally? And are you happy with us?
Yes, okay, the rotation is okay. I don't like surgery, to be honest. I like medicine. But yeah, it's one of the rotations that I should do. Yeah, trying to manage.
Okay. So, Peter, I would like today to talk to you because I'm noticed something. For that, I rush to you to speak to you if I can.
Okay, it must be a serious thing. Why you are rushing to talk to me?
Okay. So actually, Peter, I smell some alcohol from your side. Did you smoke? Did you drink alcohol, Peter?
Well, no, I didn't drink.
Okay. I'm really sorry for that. Peter, I know that is um not like question for you, but let me tell you, um I'm noticed that not only today, a few weeks later, and also noted that there's some smelling of alcohol from your side. So feel free to share your thought with me. And how do you feel about that?
No, I don't feel good about this. Maybe the problem is in your side. I didn't drink.
Okay. So, Peter, let me tell you, not only me notice that, but also there's some colleague also the nurse noted that. And let me tell you, everything will be confidential unless put anyone between you and the medical team, and let's put anyone at harm. How do you feel about that?
No, I'm not, I don't feel good. I don't want to talk about this.
Okay, Peter, as I told you, not only me, and also this is the not the first time I noted that you there is some smelling of alcohol. So if you can share your thought with me, so we can, if I can help you with that, how do you feel about that?
All right, what's the help that you are offering to me?
Okay. Do you have any idea why that we are not do you know our regulation, our rules in the hospital?
No, nothing. Regulation regarding what?
Okay. We have rules we must follow. So we need to follow that because when we are not allowed to drink alcohol before coming to hospital, and this might affect the patients and affect the patient safety, and this also affects your performance and um, your judgment about the patient cases. How do you feel about that?
I drink, I drink at home, okay? And no one can just judge me because I'm drinking at home. I'm not drinking at hospital.
Okay. Just before that, let me ask you a few questions regarding drinking, and then we can come back to that. Is that okay with you?
All right. Thank you. Thank you, Dr. Ilaf. I was difficult, I know. Sorry for that. Okay, so
Yes.
how do you feel?
I don't know because I expect when offer the confidentiality to open with me. So when you are not open with me, so oh, what shall I do?
Okay. And why you offered a confidentiality? Is it going to be confidential?
Uh,
People also notice that. And he's going to tell the consultant about this because it's concerning. Okay, patient safety is important. So is it going to be confidential?
uh, no, it's not confidential. I think in this case, when I'm told him it's confidential, but then I will break the confidentiality.
No, don't bring the confidentiality. From my opinion, from just, you know, my humble opinion about this, um, uh, do not
So
offer
shall I don't
confidentiality.
offer the confidentiality from the starting, or what shall I do?
No, do not offer confidentiality with the colleague, because this is a concern and it will be raised. It will be escalated. Okay?
Okay.
He's drinking alcohol and he is dealing with the patients under the effect of alcohol. This is nothing that it's normal to happen. Okay?
Okay.
This concern will be escalated. Okay? Yes, no, the other, not all of the hospital will know, but at least there are some people will know. Already people know that he's drinking. Okay? So it's inappropriate to offer confidentiality with colleague cases, especially alcohol colleague and Facebook and, you know, mistake. There is a mistake here. Okay? The start should be different. You are not talking to a patient to confirm his
age. Yeah. Yes, I trick myself.
Okay.
Yeah.
Yeah. Okay. And also, you don't need to start right away by telling him, there is a concern, I rushed to you uh, uh, because of this, because I'm concerned.
Okay.
Just build more rapport with him. And even when you told me, how is everything? How is your studies? I felt that you are asking me questions as as if I am a patient. Okay?
Yeah.
You have to be like, you know, more friendly with the colleague. You are not talking to a patient, okay? So the way you deal with the colleague should be totally different from the way that you are dealing with a patient, okay? In the real life, correct me if I'm wrong, in the real life, while you are talking, when you are talking to your colleagues in the hospital, you talk comfortably. Do you confirm their age or asking them how is everything and how your studies? No. Okay. So the start should be a bit different from that, and we are going to discuss how to start with colleague patients. All right. Thank you, Dr. Ilaf. It's a good trial, to be honest. I was difficult with you, but this can happen if the start is not right.
All the time I have like I'm struggling with the colleague, I think, because I didn't practice more. Yeah, I don't know.
Okay, no worries. We are going to discuss that. So do you know, all of you doctors, that the start is important? If you don't start the station correctly, you might lose the station. Okay? All right. So just I want to remind myself with the mnemonic for the colleague that I use: CTA, history, and CTS, as far as I remember. Just give me a second, doctors. Where is it? Yeah. CIA, I think. Yeah, CIA history, CTS. This is in any colleague. CIA, taking history, then CTS. What is CIA history CTS? The first C is comfortable, making him comfortable. Build a nice rapport with the colleague, okay? Then ideas. Check his ideas first. Why I'm arranging this meeting. Okay, why I'm talking to him. Why I've arranged arranged a meeting. in a quiet room. Okay? Idea. Then the aim. What's your aim in this conversation? Is it accusing him, or is it just because you are team, you are supporting each other, and you are working for the patients and the patient safety? Okay, the aim. Okay, then take history. Then CTS is confront. C is confront if he's denying. Confront him. T, teaching. You teach him the mistake. You teach him why it is a mistake, because this affects patient safety, affects the judgment of him on the patients. Also, he will be in trouble with the GMC if he's doing that, continuously. Then solutions. Okay, we are focusing on the first three, CIA. Okay, making him comfortable, ideas, and aim. All right, we start by, hello, how are you, Peter? I'm Sahar Ali, one of the doctors here in the hospital. I'm not sure if we've met before or not, okay, but nice to meet you. How was the day today? Was there any interesting case today? Was it busy? All right, so just ask him questions about the day, and he's FY2, like you, okay? He's not a student. All right, doctors? If he's a student, then you can ask him in which year, how are the studies, is everything okay, are you struggling, any specific specialty that you want to be in the future, okay? You can ask these questions. But here, he's a FY2 like you, okay? How's the day today? Is everything okay? Was it chilly? Was it busy? Okay? And then you check his ideas. Well, Peter, as you know, I've arranged this meeting between me and you. Do you have any idea why I'm talking to you? Then, first of all, I'm arranging this meeting because I'm concerned about you. We are here, team, working together, supporting each other, working towards the patient and the patient safety. If someone has a problem, we try to help him. Okay, Peter? All right. Okay. So, well, to be honest, I'm concerned because me and other colleagues in the hospital, we smelled alcohol from you today. So, can you tell me, did you drink alcohol? All right. This is if you and others noticed. Sometimes they say nurses noticed that he smelled alcohol and talking about that, and they asked you to talk to him. Then you tell him, well, okay, the nurses raised a concern regarding you drinking alcohol. Is that right? I'm here to listen to your side. Okay, you are not accusing him. You're just coming to listen to his side. What's the problem with him? And you are here to help him. Okay, this is how to start any colleague case. Okay, don't confront him right away. Just rapport, then aim, then ideas, then aim, then get into the core of the station. Got me, doctors?
Yes, yes.
Okay, so you know now how to deal with colleagues, how to start?
Yes. Doctor, shall I try to again? Then you can see me.
Right. No worries. Yeah, you can try. Yeah.
Okay. Okay. Okay. There. Hello, Peter. My name is Elaf. How are you?
I'm good. How are you doing? Is
Okay.
everything okay?
Yes. Okay. Okay. And how is your day today? Are you? Is a busy day or?
Well, no, it was chilly to be honest.
Okay. Okay. And do you have any clinic today?
No, I'm just finishing. I'm going home.
Oh, that's good. That's good. That's good. I'm
Yeah.
home finally. Yeah.
Yeah. Yeah.
Yeah. So, Peter, do you have any idea why I made this meeting with you?
No, I don't have any idea. Must be a serious thing.
Okay, okay. So let me tell you, Peter, we are here as a team. We're acting as a team. We must support each other. So if there's anything with anyone, we need to find out what is the problem with him, to support him, and to suggest for him any solution for him. So so actually, Peter, I smell some alcohol from your side. So is this the case with did you drink alcohol, Peter?
Hmm. Well,
Yeah,
yeah.
yeah.
Yes, but
Okay,
I drank yesterday.
okay, okay. Uh, okay. Let me tell you. The nurse also.
Thank you.
Thank you.
What? How do you feel?
Good. Yes, better than first one.
All right.
Yes, all right. Thank you.
Okay. All right. There is one station left. Anyone wants to do the last case? If no one, we can just,
If no one, I will do. If no one.
Okay. Yes, Dr. Iman, you can. Read the question, please.
Okay, I'm ready.
Start.
Hello, this is Dr. Iman. I'm one of the doctors in the clinic today. Would you confirm your name and age for me, please?
Yes, Doctor. I'm Adam Atkinson.
Yeah,
32 years old.
thank you, Adam. Adam, you look so confused or disturbed. Anything wrong with you?
Yes, Doctor. I just
Yeah, I can see. Yeah, are you able to continue talking?
Yeah, you can. Yes, I can.
Okay, just tell me how can I help you today?
Well, I'm here. The GB
Yeah,
referred me to this clinic to help me in quitting.
sure. Yes. Okay. So just to have a brief about the substance you use. So what sort of drugs that you use, Adam?
I use many drugs, Doctor.
Yeah. May I know anything about?
Yeah, I'm using heroin and other stuff.
You use heroin? How you use it? Do you use it by sniffing or?
Thank you, Dr. Iman. How do you feel?
I don't know. I don't know. The first time to have a scenario like this.
Okay, good. She acknowledged. Yeah, she acknowledged. Dr. Iman acknowledged that I'm disturbed, right? You said that,
Yeah.
right? Okay. You can tell me. Well, okay. We will make sure that we give you some medication or something to help you in this.
Oh yes, I should write.
Don't offer, okay, but just tell them we will make sure that we can give you a medication to relieve this itching or this.
I just told what I just told. Are you able to continue talking?
Yeah. I told you I'm able to continue. Yeah. Okay. So you introduced yourself. You confirmed and you acknowledged. Okay. And then you started. It's better not to say, how can I help? You can tell him, I can see that you are disturbed and uncomfortable. And I also know that you are here to help you to stop taking street drugs. Okay. I can admit that you are brave. This is a very good step. Thank you for coming today. We are going to make sure that you feel comfortable. Don't worry, it's a common feeling when person start stop.
Dr. Sahar, yes, this is good. Good point. Patient in alcohol and substance misuse, we have to thank him.
Yeah.
Yeah,
Thank
right.
you for
Yes.
coming. Okay.
Oh,
So
yeah.
praise him,
Yes.
and reassure him that this is common symptom with people who stop recreational drugs.
Yeah.
Okay. So these are the two things that you missed. You asked me how can I help, and you didn't reassure me. This is
I
it.
did not use most of the information here. I have information I should use.
Yeah.
And I did not thank the patient because he came.
Yeah.
Yes.
All right.
Yeah.
All right. To be honest, Dr. Iman, just for an information for all of you doctors, there are few mistakes that can pass. It's fine. If you didn't thank him, you can thank him at the end. All right. But when we talk about the start, we talk about the perfect start. This doesn't mean if you didn't do it perfectly, this doesn't mean that you are going to fail the station. But we are discussing how to be confident from the start so you go smoothly throughout the case.
Yes, right.
Right?
Yeah.
Okay. So this was the last case for today. We have practiced on 12 cases, how to start in different 12 situations, 12 scenarios. Thank you for attending. Thank you for listening till the end. Thank you for your time and for your participation as well. How did you find the session, doctors? Was it helpful? Do you find that I'm confident now to start any station, or you feel like it's the same before you attend and after you attended? You can switch your mic. You can write down. Dr. Ilaf is saying many thanks. Thank you, Dr. Ilaf. Dr. Iman, excellent. Thank you. So I have.
Thank you so much, Doctor. It was really beneficial. Thank you.
Thank you, Dr. Amin. Thank you so much, Dr. Sally. Thank you. Really so helpful. Yes. Okay. Good. Thank you. Yeah. I'm happy that you feel confident with a problem colleague now. Yes. So happy to hear that. If you can just encourage people to attend the sessions, these sessions, if you find them helpful. The next session will be, I think, discussing new and high yield cases, inshallah, in the next week. So yes, I highly appreciate if you can write anything in the Telegram group and in the WhatsApp group to tell them about the importance of attending the sessions. Are they, how helpful they are, and how they improved your confidence in dealing with the different cases. It's important to help other people. People maybe don't know about the sessions. Maybe they didn't hear about me at all. So if you find the sessions are helpful, please encourage people to attend in the groups, inshallah. And thank you so much for attending, and see you inshallah next week. Bye bye.